Alzheimer's Disease Awareness Program. This disease awareness program is about caring for patients with Alzheimer's disease. To begin with, what is dementia? Dementia originates from the Latin word demens, which means madness. It is a general term that is used to describe a group of symptoms. The symptoms of dementia include loss of memory, changes in mood, problems in communicating, difficulty in completing daily tasks, and problems with reasoning. Dementia is not a natural part of aging. Remember, you are not alone. Around the world, 50 million people live with dementia. The total number of people suffering from dementia is projected to reach 82 million in 2030 and 152 million in 2050. The occurrence of dementia steadily increases with older age. More than 90% of dementias are seen after the age of 65 years. In India, about 3.7 million Indians live with dementia. The number of people affected by dementia will almost double every 2 decades. What are the signs of dementia? Memory loss over time, changes in mood and personality, not understanding conversation easily, and difficulties carrying out daily activities. If an individual becomes increasingly forgetful, encourage him or her to see their general practitioner. What are the stages of dementia? Early stage, middle stage, and late stage. What are the symptoms of early stage dementia? Forgetfulness, losing track of time, and getting lost in familiar places. The early stage of dementia is often overlooked, as the onset of symptoms occurs slowly. What are the symptoms of middle-stage dementia? Poor judgment, increasing confusion and frustration, memory loss, needing help in tasks like dressing and bathing, and significant changes in personality. As dementia progresses to the middle stage, the signs and symptoms become clearer, and people impacted may need help from a loved one or a care provider. What are the symptoms of late-stage dementia? The person is unaware of the time and place, has difficulty recognizing relatives and friends. There is increasing need for assisted self-care and there is difficulty walking. The physical signs and symptoms of dementia become more obvious in the late stage and people impacted become dependent. So what goes wrong in the brain? There is a loss of function of brain cells or neurons that affects nerve cell connections. This kills brain cells that lead to loss of brain functions. What is the most common cause of dementia? Alzheimer's disease is the most common cause of dementia. It makes up to 60 to 80% of all dementia cases. Alzheimer's disease is not a normal part of aging. as it gets worse over time. Alzheimer's disease. What is Alzheimer's disease? Alzheimer's disease is an irreversible, progressive brain disorder. It slowly affects memory and thinking skills and results in inability to perform simple tasks. Currently, there is no cure for Alzheimer's disease, but treatment can help to manage symptoms. What is the difference between dementia and Alzheimer's disease? Dementia is an umbrella term for several diseases that affects memory and thinking ability. Alzheimer's disease falls under dementia. By determining the cause, it can be treated. Alzheimer's disease is an irreversible, progressive disease that slowly worsens memory and thinking ability. It is the most common cause of dementia. Although there is no cure, symptoms can be managed by medications. What are the signs of Alzheimer's disease? The early signs of Alzheimer's disease are difficulty in remembering recent events, decline in thinking ability, trouble in doing everyday tasks, asking the same question over and over, getting lost easily, and losing things. After progression, memory loss worsens. Some people become worried, angry, or violent. Coming to the risk factors of Alzheimer's disease. What are the chances that an individual will develop Alzheimer's disease? There are certain risk factors that increase the chances of developing Alzheimer's disease. Increasing age is the greatest known risk factor of Alzheimer's disease. Most individuals with Alzheimer's disease are 65 years and older. Family history and genetics also play an important role. Women are at a higher risk than men. However, in Alzheimer's disease, the decline in memory or thinking skills is greater than what is expected of a person's age. Other risk factors include past head injury, poor sleep patterns, lifestyle and heart health in particular, lack of exercise, obesity, smoking, high blood pressure and cholesterol level, and poorly controlled diabetes. Coming to the diagnosis of Alzheimer's disease. What are the tests available to diagnose Alzheimer's disease? The doctor will conduct physical and neurological examinations for reflexes, muscle tone and strength, ability to get up from a chair and walk across the room, sense of sight and hearing, and coordination. The doctor will also conduct blood tests to rule out other conditions like thyroid disorder and vitamin deficiencies. The doctor will conduct mental ability tests to assess memory and other thinking skills and perform a cognitive assessment to judge memory, problem solving, attention and language abilities. Brain imaging tests such as MRI or CT scan or PET scan are also available. There are no specific blood tests or imaging tests for the diagnosis of Alzheimer's disease. What are the benefits of early diagnosis of Alzheimer's disease? Early diagnosis helps early treatment, which helps in preserving daily functioning for some more time. Management of Alzheimer's disease includes pharmacological treatment and lifestyle remedies. What are the pharmacological treatments for Alzheimer's disease? Medications for memory and medications for behavior. What are the lifestyle changes for Alzheimer's disease? Exercise, nutrition, and social engagement and activities. Exercise is an essential part of Alzheimer's disease treatment plan. Exercise helps keep health of joints, muscles, and the heart. Healthy weight, regular toilet habits, and regular sleep habits. Being active and getting exercise helps people with Alzheimer's disease feel better. Importantly, remember to eat. People with Alzheimer's disease may forget to eat, lose interest in cooking meals, or not eat healthy food. So, eat healthy food. Drink several glasses of liquids. Avoid drinks containing caffeine. And drink milkshakes with protein powder. Social interactions and activities are vital for overall well-being. This includes listening to music or dancing, reading books, gardening or craft, and social events. Social interaction and activities can support the abilities and skills that are preserved. What to expect from Alzheimer's disease treatment? There is no cure for Alzheimer's disease. Treatments are available to overcome the symptoms. Medications help to slow down certain conditions such as memory loss, which help people from Alzheimer's disease to be more comfortable and independent for a longer time. Alzheimer's disease progresses over 2 to 25 years, with most patients in 8 to 15 years range. However, most patients can remain at home as long as assistance is provided by others as the disease progresses. Some tips for caregivers. Caregivers are the backbone of long-term care for patients with Alzheimer's disease. Caregiving for patients with Alzheimer's disease broadly includes assistance in the form of medical, financial, emotional, and legal support, and monitoring of activities such as personal care, housekeeping, and administration of medication. Thus, the caregiver becomes an important factor for the well-being and existence of patients with Alzheimer's disease. How to deal with the diagnosis of Alzheimer's disease? Tips to overcome the stress following a diagnosis of Alzheimer's disease include asking the doctor about Alzheimer's disease and appropriate treatment. Consider community groups offering classes to teach caregiving, problem solving, and management skills. Develop routine that makes things go smoothly. Plan your routine, especially for times when the person is less confused or more cooperative. And plan for the future. Contact organizations such as Alzheimer's and Related Disorder Society of India that extend support and disseminate information on Alzheimer's disease. How to communicate with a person with Alzheimer's disease? Trying to communicate with a person having Alzheimer's disease can be challenging. Tips to understand and being understood include: use a gentle, calm tone of voice. Choose simple words and short sentences. Minimum distractions and noise so that person can focus on what you're saying. Make eye contact and call the patient by name. Allow enough time for response and don't interrupt them. Help the patient if he or she is struggling to find a word or communicate a thought. Frame questions and instructions in a positive way. How to get a person with Alzheimer's disease to eat. Handy tips to ensure a person with Alzheimer's disease eats include: maintain familiar mealtime routines but adapt to the patient's changing needs. Give the patient food choices. Serve small portions or several small meals throughout the day. Use straws or cups to make drinking easier. Encourage the patient to drink plenty of fluids and beware of choking. How to plan activities for a person with Alzheimer's disease. Tips to keep the patient active include: don't expect too much from the patient and keep the activities simple. Divide an activity into small steps. Appreciate the patient for each step he or she completes. Watch for signs of agitation or frustration during the activity and choose activities that the person enjoys. Incorporating exercise into the daily routine has benefits for both the person with Alzheimer's disease and the caregiver. How to overcome sleep problems in a person with Alzheimer's disease. Encourage the patient to exercise, but make sure that the patient gets adequate rest. Schedule physically demanding activities earlier in the day. Keep lights dim and eliminate loud noises. Play soothing music if the person enjoys it. Keep bedtime at similar time each evening. Limit caffeine. How to cope up with hallucinations and delusions in a person with Alzheimer's disease. Keep track of what the person is experiencing and discuss it with the doctor. Avoid arguing with the patient about what he or she sees or hears. Respond to the feelings of the patient. Comfort the person if he or she is afraid. Try to distract the patient to another topic or activity. Turn off the television set when violent or disturbing programs are on. How to overcome the wandering problem for a person with Alzheimer's disease. Make sure that the patient carries an identification card and wears a medical bracelet. If the person gets lost and is unable to communicate, the identification will alert others. Notify neighbors and local authorities in advance that the patient has a tendency to wander. Keep a recent photograph or videotape of the patient to assist the police if the patient gets lost. Home safety is essential. Install secure locks on all outside windows and doors. Remove locks from bathroom doors so that the person cannot lock him or herself in. Label medications and keep them locked up. Keep knives, lighters and matchboxes secured and out of reach. Keep the house free from clutter. Be alert to address kitchen safety issues. Tips for scheduling a doctor's appointment for a person with Alzheimer's disease. Try to schedule an appointment for the best time of the day for the patient. Let the office staff know in advance that this person may be confused due to disease. Don't tell the patient about the appointment. Carry something for the patient to eat and drink and any materials or activities that he or she enjoys. Have another member go with you so that one of you can be with the patient while the other speaks with the doctor. How to plan holidays for a person with Alzheimer's disease. Keep or adapt family traditions that are important to you. Involve the patient as much as possible. Encourage friends and family to visit. Avoid crowds, changes in routine, and strange places. Do your best to enjoy yourself. Ask a friend or family member to spend time with the patient while you are out. At large gatherings, have a space available for the patient where he or she can rest, be alone, or spend some time. Let's discuss prevention of Alzheimer's disease. Can Alzheimer's disease be prevented? Alzheimer's disease is not a preventable condition, but heart-healthy lifestyle changes can reduce the risk of Alzheimer's disease. Minimize the intake of saturated fats and trans fats. Saturated fat is found primarily in dairy products, meat, and certain oils such as coconut and palm oils. Trans fats are found in many snack pastries and fried fruits and are listed on labels as partially hydrogenated oils. Include more vegetables, legumes, fruits and whole grains than meats and dairy products in your diet. Consume food rich in vitamin E rather than taking supplements. Food sources of vitamin E include seeds, nuts, leafy green vegetables, and whole grains. Include fortified foods or a supplement containing vitamin B12. Vitamin B12 should be a part of your daily diet. Check the blood levels of vitamin B12 regularly, as many factors, including age, may impair absorption. Avoid using multiple vitamins with iron and copper. Use iron supplements only when directed by your physician. Minimize the exposure to aluminium. Avoid the use of cookware, antacids, baking powder, or other products that contain aluminium. Include aerobic exercises in your routine. Aim for 40 minutes of brisk walking 3 times per week. Maintain a sleep routine that will provide an appropriate amount of sleep each night. Sleep for approximately 7 to 8 hours. Engage in regular mental activity that promotes new learning. Try for 30 minutes per day, 4 to 5 times per week. Maintain blood pressure and cholesterol level. Control diabetes. And stop smoking. About caregivers. Caregivers also need care. The impact of providing care includes elevated levels of depression and anxiety, higher use of psychoactive medications, worse self-reported physical health, compromised immune function, and increased risk of early death. Over half of a caregiver's ability to provide care declines due to compromised health. What are the facets that keep the caregiver going on? The positive aspects of caregiver include a sense of fulfillment, establishing extended social networks or friendship groups associated with caregiving, feeling needed and useful, learning something about oneself, others, and the meaning of life. How can a caregiver take care of him or herself? Learn more about the disease. Eat healthy foods. Ask for help when you need it. Take a break every day. Spend time with your friends. Make use of a local adult day center if possible. Join a caregiver group support. Get exercise as often as you can. See your doctor on a regular basis. Keep your health, legal and financial information up to date and keep up with your hobbies and interests. To sum up in a gist, Alzheimer's disease is the most common form of dementia and may contribute to 60 to 80% of cases. No specific blood test or imaging test exists for the diagnosis of Alzheimer's disease. There is no cure for Alzheimer's disease. Treatments are available to overcome the symptoms of the disease. Alzheimer's disease poses real challenges for both the person diagnosed with the disease and the caregiver. But this does not mean that there will no longer be times of joy, shared laughter, and companionship.